is responsible for release and synthesis of the calcitonin. So the calcitonin, it is a hormone which play important role in calcium homeostasis, and it decreases the blood calcium level. We have to find out the synthesis of the calcitonin in which organ. Here the options are parathyroid gland, anterior pituitary gland, thyroid gland, posterior pituitary gland, and adrenal gland. First of all, the calcitonin, it is secreted by the C cell of the thyroid. So the calcitonin, it is released from the thyroid gland, and in the thyroid gland there is a special type of cell which is the parafollicular cell or C cell, and this parafollicular cell or C cell, it secretes this calcitonin, and this calcitonin, it reduces the blood calcium level. It reduces the blood calcium level, and it inhibits intestinal calcium absorption, and it also inhibits the osteoclastic activity, and it inhibits the renal tubular absorption of the calcium. That means in the all form of calcium, it reduces acting on the different site. The calcitonin has opposite effect of the parathyroid hormone. The parathyroid hormone usually increase calcium and decrease phosphate level in the blood, but the calcitonin, it causes the opposite. And the parathyroid gland, this is released from the parathyroid hormone, it is released from the parathyroid hormone, but calcitonin, it is released from the thyroid gland. So let's see the function of the calcitonin. Its final action is to reduce serum calcium level or blood calcium level, but it acts by which we know that there are three important organs which plays role in calcium homeostasis. One of them is kidney, bones, and intestine. What calcitonin does, when it released from the parafollicular or C cell of the thyroid gland, it acts on the kidney and it inhibits calcium reabsorption from the kidney. So urinary calcium increase, but blood calcium is reduced. On the other hand, it acts on the bones and it inhibits the calcium deposition in the bone by stimulation of the osteoclast, and this osteoclast stimulate osteoblast, and this osteoblast causes the calcium deposition in the bone. As there is inhibition of the osteoclast, so passively osteoblast activation also reduce, and calcium cannot deposit in the bones. And from the small intestine, calcium is reabsorbed by 125 dihydroxycholecalciferol, which is the vitamin D, activates from the kidney, and this 125 dihydroxycholecalciferol or vitamin D, it cannot works on the small intestine, and there is no absorption of the calcium. So these important three mechanisms are inhibited by the calcitonin and causes reduced blood. So from which the synthesis of the calcitonin occurs, it is the thyroid gland. It is the thyroid gland. It is not parathyroid or pituitary or adrenal gland. It is the thyroid gland.